love the music. Let me tune this on. Okay, can you hear me? Can you hear me? Can you hear me? It's not on yet. Okay, we're on. I just love the music. And I wanted to ask our brother, do you have a YouTube channel? Long and do my Bible study reading, listening, and doing everything we do. And if you let us use your music for our background programs that we have, we will help you if you need help. But I'm amazing. I play piano, I do arrangements, but yours is amazing. So praise the Lord for that talent we can use for God all over the world, right? It's a beautiful, beautiful arrangements. Okay, so today we're going to do natural remedies, and I'm going to start with super healing foods. So maybe we can put this in there. Okay, good. But let me pray it again, okay? Let's pray. Dear Heavenly Father, we just want to ask you your presence and that you touch my tongue, but that comes with, this is my second language, so I just want to ask you that it's clear and simple and everybody can understand. So please bless this class and that can be a blessing to all of us here. In Jesus' name, amen. Okay, so these are the super healing foods that we incorporated into our protocols. And these are so simple. What I like about these components of foods that God has created is because you can use it in any part of the world. God is not selective to rich people, because sometimes people say, buy this and it's very expensive, and only put in water overnight and it's going to leach the bitterness, latex, things like that. So that every day we're going to change the water and we're going to use a piece of the gel about 1 inch by 1 inch, and we're going to chew it, eat it 15 minutes before meals, because we want to create a coating in the lining of the digestive system to help us heal those areas that are diseased, right? We have esophagitis or gastritis, ulcers. We have leaky gut. Also, we can have irritable bowel syndrome or any conditions of the bowels. So this is one of the things that we're going to use, and we use it every day, and we use it at bedtime also. So 4 times a day. By the way, people that have heartburning, this is the best treatment. We have a few doctors that work with us and do classes with us for our trainings. And Dr. Arby is her name. She's an internal medicine doctor. She practices lifestyle medicine purely. Well, what she does is her patients, she does telemedicine, and she has her practice. She's in Washington. She, instead of giving medications, she does lifestyle with them, and they decrease medications instead until they don't need it anymore. So that's how she practiced lifestyle. So she was saying that aloe vera is as good as the protein inhibitors. It's as good as that. So, but we found out it can be even better, because we had one time a lady that came to a lifestyle center, and her husband was having heartburning, serious heartburn, so he went to the ER, and they gave him more medications and nothing was touching. So then the next day we heard this, what Dr. Arby was saying. So I said, okay, have him do a good amount of aloe. Chew it, and just eat it. That did it. Stop the heartburning. So that was such a blessing. So, it is powerful. So I did studies on aloe vera. Usually when I do a study, I go through 200 studies. And then I pick up this, I do summaries of all that. And so I found out that in these studies, they say that aloe vera is anti-inflammatory, antimicrobial, so it balances your bacteria, right? Microbiome. It's anti-cancer. So if somebody has stomach cancer, I'm going to give them this too. Then antioxidant, and we want that because it's a lot of oxidation when we're sick and we're having a lot of symptoms. And then it's antifungal. Fungal infection is very difficult to take care. If you have a fungal infection in the lungs, your immune system is very depressed, and you have to be in medications like for 6 months. Sometimes doesn't even help. So we help, people that have been on so much antibiotic, heavy-duty antifungal medications, and doesn't even touch it. They said that it might help. Can you believe that? But aloe vera is antifungal. Also, it also helps digestion, and this is based on all the studies that I collected. Heals wounds, bone repair. Can you believe that? Who would have thought it repairs bones? Decrease glucose, so it's good for diabetes. And because, we do all these super healing foods in our lifestyle center, people that have diabetes, type 1 and type 2 usually in 10 days they're not going to need medications. And even type 1, they decrease the medication greatly to the point that they almost don't need medications, even type 1 diabetes. Because all these super healing foods, if we're persistent in use it, it's going to have a good impact in our health. Then we have also the studies show that it does decrease cholesterol. Isn't it amazing? It helps your liver and regenerate tissue. So if we have, sometimes when we have people that are bleeding, colon bleeding, because they have irritable bowel syndrome or Crohn's disease, what we do enemas with aloe and onion. Onion garlic broth, we mix it with aloe, we just blend it and do enemas with that. So what is going to help? It's going to help healing the lining. It's going to help balancing the bacteria, which is the problem. So it's just super amazing. These super healing foods, if we use it in the right way, are going to have an incredible impact. And then we have regenerate, that's what I just said, immunomodulator. You know what this means? When you're dealing with autoimmune disorders, the immune system is very stimulated because we put in so many toxins in our body. So the more toxins, the more stimulated because they're trying to clean. So the immune system is your friend. But there's a treatment when you're so diseased with autoimmune disorders. You know what is the radical treatment? Chemotherapy. Because they want to destroy the immune system. But the problem is not the immune system's overstimulated because it's trying to help you clean up all these toxins that we're putting. So anyhow, the aloe vera calms down the immune system that's overstimulated. So imagine, simple aloe, all the things that it does. The other super healing food, okay, I'm going to finish with this. In particular, according to the study, new pharmacological data research has shown that most studies refer to anti-cancer action, skin, digestive protective activity, antimicrobial properties. So this is a research for 2020. My computer is going down, sorry, I didn't realize. I have, if I can connect it, my connector in my bag. Okay, so we're gonna go to the next one. This is my favorite of favorite super healing foods that I have. And if you can just bring it, I can find it, it's in the front. Yeah, so the onion is one of my favorite of all treatments.
Here, keep it more front. Mm-hmm. You're right, there's so many.
Okay. Yeah, so onion has incredible properties also. And so all this is from studies also. I just put what they do, what the study mentioned it about the properties. I didn't put all the studies. I have actually studies with every study. But, I'm just bringing the highlights. Okay, so, onion has quercetin, right? Quercetin, that is so powerful anti-inflammatory. That's why we like it a lot. It's antioxidant, according to the study. The quercetin has anti-inflammatory effect, anti-proliferative. That means cancer is proliferating It's going to stop the proliferation of cancers. So if somebody has a stomach cancer, I'm going to do a lot of onion broth. Or somebody has any issues with inflammation in the digestive system, we're going to do a lot of onion broth. And if somebody's going to have colon cancer, guess what we're going to do? Enema, right? Because you want to attack it directly into the problem. And it's anti-diabetic, so no wonder these people that come with diabetes, the blood sugar is going to keep coming down. Remember the aloe brings it down? Well, the onion also. So when you do all these super healing foods, synergetically it's going to work in a powerful way. And it's also good antimicrobial, so it's going to balance your microbiome, which is a big problem with autoimmune disorders or any chronic disease, and cancer also. Anti-aging, so drink a lot of this if we want to be young. Anti-obesity also. So onion and garlic among all the oldest cultivated plants. You know, God has given this is, you're going to find any place in the planet, right? And it's cheap. It's not going to be expensive. They're used for food and medicinal applications. In fact, these common food plants are a rich source of several phytonutrients. What else? Good for cancer, coronary heart disease, obesity, hypercholesterolemia, type 2 diabetes. There's studies also for type 1 diabetes, hypertension, cataracts, even for your eyes, and disturbances of the gastrointestinal tract. So also for digestive issues. So this is super, super powerful. I like to drink the broth, but I also like raw. So I usually get a little onion, chopped finely onion, and I eat a little piece of that while I'm eating my food too, because I want both. I want the raw and the cook, because it's gonna work differently. Okay, this study shows that onion helps gastric ulcers, gastroprotective. So good for people that had ulcers because of alcohol. So there was this lady that, she said that her hemoglobin was like a 3 something. So she could have died, but she survived. What they found out why the hemoglobin was so low is because she had 5 ulcers in the stomach, and they were bleeding. So I said, well, come to my home. So I invited her to eat on Sabbath to my home. So I went over all these things that she can do. So she started doing a lot of the onion broth. So it takes a while to recover to heal the ulcers. But in 3 weeks, 3 of the ulcers were gone. So then she had 2. So these are very powerful. So we just have to be very consistent. It has to be every day if you have an ulcer or stomach cancer or gastritis. Now we're going to talk about turmeric. I'm going kind of fast because we're going to talk about the protocol also. So turmeric is another super healing food, and you can find any place right in the world also. What is turmeric? In the studies was found that turmeric is good for cancer. So if you have a skin cancer, what do? You just mix a little bit of turmeric powder with a little water, and just put it in your whatever it is, and put a Band-Aid. That's it. So we had a guy that had a skin cancer here in the nose. So Dr. Joyce came to that program, and we were trying to, okay, what do we do with this person? So they said, okay, let's put a turmeric, because you can do also onion. It will help cancer also. Because remember, it's anti-cancer onion also, and also aloe is anti-cancer. So we decided, let's do turmeric. So we put turmeric. The next day, that piece of cancer was out. So it's a pink here. So I said, you have to do it every day for 2 weeks, because we don't see them. There is small cancer probably left in there, so you have to be consistent for 2 weeks. So it was out the next day. It was surprising. So then is antibiotic also, turmeric, anti-inflammatory, anti-aging, antioxidant, anti-neoplastic, good for cancer also. So if somebody had a colon cancer, I'm going to do enemas also, mixing the three of them. You know how aloe is anti-cancer, onion is anti-cancer, and turmeric is anti-cancer. Remember, you put a little paste with a syringe into the place of the cancer is. Usually it's pretty close to the rectum area, the colon cancer. So then it's also anti-nociceptive. Who knows what does that mean? That's for pain. So it helps pain. So it's not like when you go to a store, you take a pain medication and then you're going to be free of pain. It takes time. So usually it takes about 2 weeks taking every day until the pain is gone, because pain is inflammation. So the inflammation goes down while you do all these healthy foods, and in 2 weeks, usually the pain is down or gone. So it's good for pain. It's anti-diabetic. So guess what? Somebody has type 1 diabetes or type 2 diabetes. I'm giving them what? Aloe? What else? Onion? Then turmeric. Those three are working to decrease. So no wonder the blood sugar is coming down so fast. So we had to decrease so fast the medication until they don't need it any longer. So what I do is I ask them to call the doctor and say, I'm eating very healthy, and my blood sugar is so low, can you decrease the medication? So the doctors start decreasing. Usually by the 10 days, they don't need it anymore. And then it's also anti-allergic. So if the patients or the guests are going to have allergies, it's going to help for allergies also. Turmeric is a commonly used spice throughout the world, has been shown to exhibit anti-inflammatory, antimicrobial, antioxidant, anti-neoplastic properties, super powerful for cancer. So, there is thousands of studies. Last time I checked, it's more than 8,000 studies on turmeric. And so the other ones too. Onions, I think was 7,000 studies on onions. And aloe, there were not as many. Then we're going to go to orange peel. And all these super healing foods, we use it in our protocol, as I was saying. So orange peel is super amazing. In the studies shown that orange peel is good. It's antioxidant. If you eat the peel, right? So eat a little of the peel, put it in your smoothie, a piece of the peel of orange, and it's just very powerful. That's how we do it. We do smoothies every day because it's easy to put a stuff that it needs to be in order to have a, very balanced breakfast. So we put usually 2 teaspoons of that every morning, or you can put also 1/3 of your orange, or if it's a small orange, you just put the whole orange. So also decrease diabetes. Can you believe these all do amazing things? So if I have diabetes, what would I do? Again, it's a review. Number 1, aloe. Number 2, onion. Number 3, turmeric. Number 4. Imagine, I do all this. No wonder by then, 10 days, the diabetes is gone. Of course, we're eating healthy, right? We're removing the cause of diabetes, which is an inflammatory diet. And then it's anti-inflammatory, it's anti-lipid. So it's going to decrease our cholesterol. It's going to decrease triglycerides. Usually it takes about 3 weeks. If in 3 weeks they go back, it can be less than that. But, we give it a chance for 3 weeks at least, and they can do labs again, and all the labs are going to be decreased greatly. We don't do it really quick because the doctors won't want to order so fast these tests. And then we go, it's antibacterial, same as the other ones, anti-cancer, same as the other ones. So if I have cancer, what do I do? Number 1, aloe, onion, turmeric, orange peel. See? For all these difficult conditions. Also antifungal. Can you believe? Because it's very hard to get rid of fungal infection. The only thing we found out fungal infection that's natural for fungus in nails is sun exposure. Sun exposure, you cut it really, really, as much as you can, you expose to the sun. And then keep doing that, keep doing until the nails are fine. So then, because they don't survive with light and darkness, and so that's a good therapy. So there is a study here that shows good for cancer, and reduction in edema, inflammation by more than 85%. So what we found out that orange peel is good for problems, brain problems, inflammation in the brain, and all these neurological conditions. It's very, very powerful. Okay, so I just want to give you a summary of how amazing are the soup and healing foods. So this we added into our protocols every day. So in the morning, we have turmeric, 2 teaspoons. We mix it with, some people like it with coconut milk and a little honey, and it tastes good. I like to put it with a little bit of my smoothie, and I eat it. I don't want to damage the whole smoothie, so I enjoy my smoothie, and I just have a little at the end. So I have a turmeric. Some people like it with, we have a drink with garlic, lemon, and a little water. So they like it like this, whatever it takes to take it. But it's better to do with fat. And at breakfast, you're going to have some type of fat at breakfast. So I'm going to go to another PowerPoint to go over the protocol now. Let's see. Okay. So we're going to talk a little bit about autoimmune disease. Okay, so yesterday I was saying there is 3 components, right? There is inflammation, there is leaky gut, and there is what else? Microbiome. Components that we have to take care of those, but it's also a genetic component. But the genetic component is only 30%. Multifactorial other environmental factors is 70%. So, you can shut down genes, right? And when we do good lifestyle practices, so that's what we have to take care. So we're going to talk a little bit about that, and then we can go to questions and answers. Okay, what are the triggers? Because these are the triggers. This is not what is causing autoimmune. Autoimmune, usually you have a genetic component, but what are the triggers? Some people have, the gene, but they never had the disease because they didn't have, they follow a good lifestyle. And so triggers are, it can be drugs, it can be vaccines, it can be contraceptives, hormone replacement therapy, it can be infections of any type, viruses, bacteria, fungi. It can be toxins, mold, pesticides, plastic, heavy metals, hair dyes, cosmetics of body care ingredients. Also can be in nutrition because of the preservatives, emulsifier, thickeners, vinegar, pickled foods, gluten. It can be also stress, emotional, physical, mental. This is a big one. So, we really had to follow the fruits of the Spirit and ask God to help us somehow manage our stress because, stress is a difficult one. And, sometimes only God can help us with that. Because we all go through stressful times and sometimes it's nothing that we can do, but the way how to manage it, how to control it is what is going to be important. So stress can be emotional, physically, because even stress from having an accident can trigger your autoimmune, an autoimmune disease. So also bitterness, resentment, and a lack of forgiveness can cause stress to consume our resources. Depression itself is a known risk factor for disease. So other triggers are lack of sleep, lack of exercise, not following the laws of health, fresh air or sunlight. Do you know that sunlight is just so powerful? It's not just the vitamin D effect that is important to the metabolism of, calcium and minerals, things like that. But, it's anti-inflammatory. The rays can go through the bones. If you have infection of the bones, it's just super amazing. It balances your hormones, decrease your blood sugar, decrease your blood pressure. Does many things. So it cannot be replaced by vitamin D. If it's winter, you take vitamin D because there's no sun. But during the summer, I'll tell our clients, our guests, you have to have you get your vitamin D because it's going to do many things. It was going to decrease. So if somebody has diabetes, guess what? I'm going to send them often to the sun because they can decrease like 30 points, 30 units. And then later on, another 30 units. That's 60 units. It is like an insulin shot. Can you believe that was one study I read that's it's kind of like insulin shot. It's just amazing, the loss of health that God has given us. And even, if you have high blood sugar, will decrease it. But if you have low blood sugar, it will increase it. Isn't it perfection? So loss of health that God has given us are just perfect. So then, these are the references. What is disease? This is an effort of nature to free the system from conditions that result from a violation of the laws of health. Okay, we added one law of health for these times, which is the environmental. Because that's one thing that in the past, it wasn't an issue, but now it is an issue. So if we eating those toxins or we're cleaning supplies in the house, cleansing things, can be very toxic also. So we had to use things that are more natural. So we like to use vinegar. I make my own vinegar, so I mix vinegars and soap and some baking soda to clean, instead using Clorox, things like that, all those fumes that can be triggers also. So we had to be very mindful of that too. Okay, so, as I said, we moved 2011. 2012, we started our first program. We teach, I didn't know anything about how to grow plants, so I invited an expert to teach us, and I want to take advantage that, we came there to teach, right? So we invite people from all over. Send an email. 30 people came to that class. So he was teaching all of us. So I'm learning. So it's amazing. But by the end of the class, 2 days, we had gardens already. And then trees, we planted trees, LNGY method. So that's when we started our first program. We moved in August, and in September, next month, October, 1st of October, we have in the class. And then 2013, we started our program in January. So, we're blessed when we learn with others at the same time. So because these people that came work hard and put my garden. So it's a blessing. Okay, so this is a home-based lifestyle education, and we do 10-day programs. What we teach is principles of the autoimmune plant-based lifestyle. And one thing that is very important of what we do is a staple thing that we do is that we soak and sprouted our legumes, our fatty acid seeds, and our pseudograins. And I'll explain why I'm saying pseudograins and not grains. So we sprout that, and it really makes a difference because it's going to raise the nutrition, and it's going to decrease the anti-nutrients, and it's going to be easier for digestion. So that's why we sprout everything. So this has been something that's been very helpful. Some people said, I can tolerate some of those foods when they sprouted. Some people might still have issues, so then we have to go deeper into the problem. Take care of the leaky gut issue until they're able to tolerate. Because if you're able to tolerate in the past, so it's something is causing this. So we also do natural remedies. So we do the poultices, depending what it is. We like to do also hydrotherapy for digestion, because we focus a lot on digestion. So we do heat the stomach with hot towels for about 20 minutes, finish with cold, and then we do abdominal massage, going the way anatomy, following anatomy of the colon, and do that until, it's usually when they have pain, we do that and the pain is resolved very quick. And then also we do massage because some people are constipated or have pain and things like that. So we do natural remedies of different types. And of course, we ask continuously God to guide us what exactly we need to do for each client, because every person is different. So we eat to heal the gut. That's one of the main things, because there are studies that show that leaky gut is linked to autoimmune disorders. So whether you have symptoms or not, because I didn't have symptoms, I didn't have any bloating, diarrhea, nothing, pain, but I couldn't, my iron was low. So I had leaky gut, serious leaky gut. That's why I had to get transfusion and iron infusion. So I didn't have it was silent leaky gut. And so it was the only indication was because my iron. So some people will not have that, so it's very important to do your labs at least once a year. And if you do have issues, we usually do the basic plus the inflammatory markers labs, which is the CRP, ESR, ANA. And the basics test will be CBC, CMP. If they have their high risk of, heart, we do the cholesterol panel, lipid panel. And if they have issues with thyroid, we ask them to do the whole thyroid panel. So it's going to depend. Okay, so we eat organic for the most part. The only thing that we don't eat organic is fruits that have thick skin. Everything is organic because the vegetables are so fragile, so if they use pesticides, we're going to eat pesticides. So that's a trigger. If we do legumes, they use heavily, not just pesticides, they use glyphosate to dry it faster. So we eat our legumes organic. So for grains, they dry the grains with glyphosate. Guess what? Same as gluten, this is a grain, right? They dry it with glyphosate, right? So create a good flour. What is another grain that is so common for us to eat? Oats, okay. They do the same thing. They dry it with glyphosate, and they grow together. So if you have been sick and you have been affected by the oats, then the oats can be a problem also. It's pretty common, and a lot of people don't realize that. Okay, so we eat organic, most of it. We try to do a lot of raw foods, so try to aim for 70% raw, fresh, and 30% cooked. And the reason is because the raw food has the enzymes to digest the food and has the vitamins. So we try to do a lot of raw. So salads are going to be big. You don't want to do a regular little salad. If I eat salad, it's a bowl. Otherwise, I eat a pesto because it's a big amount of vegetables. So we do a lot of fresh foods. And we also, as I say, we soak the seeds, grains, nuts, even nuts, when we start eating nuts later on, legumes. We eat fruits at breakfast and greens at lunch. We hydrate ourselves well throughout the day. We had a guy that came to our program. He had Parkinson's disease. He was drinking 2 cups of water a day. Can you believe that? A tall guy. He was like 6'2", 6'3". So I said, no, we had to do more water. And he said, no, it made me sick, the water. Yeah. You know, whatever it takes, put your timer at 2 o'clock in the morning, just drink and go back to sleep. And then put at 4 o'clock and drink and go back to sleep. Whatever it takes, you're not going to get better if you don't drink enough water. You have to flush all these toxins. You know, there's toxicity all over. You know, Parkinson's toxicity. So I was just really working really hard for him to do this. Because especially when you get older, you don't have the sense of, that thirst. So it's very important to drink good amount of water. So how you drink water? Half of your weight in ounces. That's how much you drink. Okay, so avoid drinking with meals. So we don't dilute, right? We don't want to dilute our acid and our enzymes. We do drink 4 ounces. The reason is because in our protocol, we take 2 cloves of garlic with 1 tablespoon of lemon juice and 4 ounces of water. We blend it and drink it. So it's a small amounts. And the reason is because if you put less water, it's so strong. With 4 ounces, seems people tolerate it well. That's the only reason. If you want to do that, just chew in your garlic, which is hard. You can do that too and just drink your lemon. But we found out that is the easiest way to do your garlic lemon. And the garlic is for balance your microbiome, and the lemon is to give the acidity the stomach needs to process your food, especially proteins. And then we eat 5 hours apart. So if somebody's going to do 3 meals, we have to do 7 o'clock, 12:30, and 5:30. Because we have to eat our last meal early. We don't want to eat too late. That's one of the principles that we learned from Ellen G. White. Don't overeat because you run out of, enzymes if you overeat. So we eat also our fruits are low glycemic fruits. Why? Because one of the issues is the microbiome, right? So if you eat fruits that are very sweet, then the microbiome problem is not going to be solved as fast. And right now, I recover from, for many years, so I can eat any fruit. But if I'm in the protocol, and I only can eat low glycemic fruits. So we have few fruits that we eat as all the berries, any type of berries, the granite meal, apples. We have pomegranates for some reason, balance the microbiome, because I had one guy that had serious candida, but that didn't cause issues. Then we have the big fruit. What is that called? That's not orange. Grapefruit. Grapefruit is another one that can be eaten. So we stay. When you go to other countries, they have more low glycemic fruits, tart fruits. So you can have those too. Okay, so it's low glycemic foods. Then we have, if we eat 3 meals, the last meal is light. So Ellen G. White said fruits and grains are okay, so we do pseudo grains and fruits for dinner for people that need to eat dinner, especially if they need to gain weight. And then, of course, we chew well, right? That's the only time I spend time. I'm always in a rushing. But when I'm eating, I relax. And I like to relax when I'm eating, and it takes forever for me to finish a meal. But and of course, I talk a lot too. But I like to relax when I eat my meals and chew well. I like to chew my food well. Eat in a pleasant atmosphere, because if you're upset, it's gonna delay the digestion process. Or if we do a heavy exercise right before meals, you have to relax first, take a deep breath, several deep breaths, and that should be helpful. also avoid grains and nuts for 2 to 4 months. So we don't eat grains and nuts. Why? No grains. Do you know paleo? Paleo? Okay. So paleo, what they do, they remove grains, right? And guess what? People get better. I mean, they don't go in remission or heal completely, but they feel better because the grains really cause a lot of issues. So they're a little harder to digest. And nuts, also a lot of bloating with people that have digestive issues. So instead grains, we use pseudo grains for 2 to 4 months. After that, we reintroduce again the grains that we are able to reintroduce. So we do quinoa, amaranth, buckwheat. There's one that most people don't know is cañihua, very tasty. And so I think people from South America knows that. So those 4 is we base our cereals. And also nuts, instant nuts, we use sunflower seeds and pumpkin seeds. But for arthritis patients, they cannot tolerate not even the sunflower seeds, pumpkin seeds. They cannot tolerate a lot of stuff. So we have to be very careful introducing one food at a time, especially proteins, to see what they can tolerate and what they cannot tolerate. Some of them cannot even tolerate any legumes or any pseudo grains. Can you believe, how do you feed them? So we go very heavily trying to take care of the leaky gut, and then we had to do proteins based on chia seed and also flaxseed, and just, we do a lot of roots and juices and things like that until the immune system calm down and they can start tolerating. Sometimes what we do is we have to cook several times the legumes, and then they tolerate better, things like that. So, arthritis is a little tough, but if they eat like sunflower seeds, the whole inflammation comes back, and they're in a lot of pain. So, and then, okay, we said about that. Flaxseed and chia seed is going to be part of the protocol. So, can you believe flaxseed, when people have hot flashes, we treated that with 4 tablespoons of flaxseed. So 4 tablespoons of flaxseed will be super good. But it's not going to work immediately. It's going to build up. It's going to be 2 to 3 weeks after taking 4 tablespoons of flaxseed till it balances the hormones, and then they're not going to have flashes anymore. But if you stop doing that, in 3 weeks, all your hot flashes is going to come back. So, that's part of our diet for life. So if somebody is, this is postmenopause, this under is going to be 2 tablespoons. And for men, it's going to be 1 tablespoon before 50. After 50, it's going to be 2 tablespoons. And if people have prostate issues, we give them 4 tablespoons to balance their hormones. And that helps. Okay, then we do charcoal. So at night we do 1 tablespoon of charcoal with 1 cup of water. We have studies on charcoal. Charcoal does so much stuff too. Decreases cholesterol, triglycerides. There's a list of what charcoal does. Of course, it's a powerful detoxifier, and that's what we need because autoimmune disorders are toxicity. So we do 1 tablespoon with 1 cup of water at night. Charcoal, by the way, I'm just going to give you a little tip of what I do. I've been doing this. When I left Texas to open up this lifestyle center, I used to go to the dentist every 6 months, and I always have a cavity. They had to fix it. So when I came, I didn't have insurance, and I went per diem, so I didn't have insurance. So I decided I had to do something. So I started painting my teeth with charcoal. So not brushing, right? You don't want to remove the enamel. After I brush and floss, I paint it softly with charcoal. And then every night. So after a few years, I went to the dentist. There was no cavities, no gum problem, No, not at all. Imagine if we all do this, it will save us a lot of money, a lot of pain also. So I still do, even when I travel, I carry my charcoal and I paint my teeth with charcoal. It's gonna balance the microbiome in the mouth. So then you're not gonna get the cavities and the gum disease. So it totally took care of that. Something so simple. It will save you a lot of money. I'll tell the people that come in my lifestyle, if you just came for that, you just saved several thousand dollars. So that's one thing. So charcoal is very powerful. It's going to keep pulling toxins and cleansing. So we do that while you're in the protocol. The aloe vera, like I said, 1 inch, 15 minutes before meals and at bedtime. Turmeric powder we do at breakfast, as I said, with large amounts of greens. The onion garlic, we do it at night. That's our dinner. It's just a broth. But if you're very sick, I will drink it instead water for a few weeks. And then garlic, there's the garlic, 2 cloves of garlic with lemon juice at meals, 2 meals a day. And then we do juicing, green juices, 30 minutes before meals. And the juices, there is a science behind juices also, because if you do too sweet juices, are going to unbalance the bacteria too, right? So if you do 100% carrot juice, I used to do that. 2 carrot juices, a lot of beta carotene, but it's too sweet. So we used to do 2/3 of carrots and 1/3 of greens. So people that had candida, it didn't help at all. So we said, let's do 50-50. Oh, that's better. But it wasn't great yet. So what at work we found out it was 1/3 is the carrot and 2/3 is the greens. And from the 2/3 we do, half a cup of cucumber juice, half a cup of lettuce juice, half a cup of celery juice, and half a cup of cruciferous. And the cruciferous are rotated. And then we mix all that, and then that's your juice for the day. And we do juices for 2 days, and that has worked. Some people are super sick, then we remove the carrots totally. But usually the other ratio works well. So we have, this is our loss of health, it's wholeness. This was created by Dr. Joyce Chase. So it's water, habits, oxygen, love, environment, nutrition, exercise, sunlight, and sleep. So the environmental part is what we added because we thought was very important for these times. Remember, the health message is progressive, right? Okay, so that's what's going to happen. There's so much pollution in this time of life. What do you do about the pollution? Sometimes there's nothing you can do about the pollution, but you can eat foods that are going to detoxify you from those pollutions, so pollutants. So what you can do is, do you know that apple is very good detoxifier? Also cilantro, heavy metals detoxifier. So I eat cilantro every day. So even when I came driving here, our salad was a bunch of cilantro. It was just washed. Put it in there, a bunch of parsley, because I didn't have time to make salad or pesto. So we just put a little lemon and salt. Oh, so good with the rest of simple food. And so we had to detox. We had to eat to detox also at these times. So, these foods are, you can call it plant-based also. You can find ice cream, plant-based ice creams, and you can, all this, but they're very highly processed. They're super processed foods and with so many chemicals. So those are triggers for autoimmune. So our foods, we cook it from scratch. Everything is from scratch, so we know what is in there. And so that has been super helpful for us. And here's more foods that are, some are genetically modified, the liquid aminos, MSG, and you go buy these burgers that are plant-based, but they're incredibly not healthy at all. And even our milks that we make our own milks, so our own breads. It's in a simple way, we created ways that, we blended our mixtures for bread that's all we do. And then you just pour it, and then you bake it. Something very simple, because we want to be sure that we're not, burdening people, because you're going to cook from scratch. And a lot of people don't cook anymore because it's so easy to buy things, right? Or combine the process with some fresh in the house. I want to just present this case, and we'll finish with this, I think. Oh, no, this is a lady I presented earlier. Remember the feet, very swollen? So that's exactly the same case, but I didn't show pictures, maybe. So she had a lot of bleeding, internal bleeding. So a lot of swelling, and that was after normal now. And there is another case, this lady. So she came to a lifestyle center, and Dr. Joyce was there too. And so this lady was super, 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 super sick. For many years, she said that sometimes she was laying down in bed and cannot even get up to get a glass of water, and the husband had to come. And so she was very sick. In the past, she liked to work with horses, but now she's disabled. So she's 54, diagnosed with type 1 diabetes in 1981. So since she was pretty young, and also Hashimoto since 2012. So she came with insulin, large amounts of insulin. It's 30 units a night, and the basal, and all kind of, insulin, the short term, the long term, So she had this machine, right, that I could check her blood sugar, because when they come to our lifestyles, the blood sugar can come down so fast that they can get very hypoglycemic, and they can crash. So at middle of the night, it's beeping. Oh, the blood sugar is 50. Oh, I better run. So run down, get some apple, carrot and apple. I wouldn't give them juice. So she's crunchy, waking up the other with just chewing. And then next night, again, it's down. One night was 30. And she was still conscious, but kind of going unconscious. So at that time, I said, okay, she's drinking the juice. And then I gave her sauce. I can't, applesauce, so I brought applesauce, gave her that. So she came back, and she adjusted the amounts of insulin. So great. She went from 30 units to 10 units of insulin. And one of them, we removed it, something like that. The doctor removed it. So it was just incredible change. But the most incredible change was her physical and mental, because she was very depressed. Imagine so many years sick. So she had that. Okay, so we apply all the protocol. Remember, all this, all these super healing foods are going to decrease the blood sugar. So we did all that. No wonder the blood sugar was coming down so fast. I'm just going to tell you one story. For a lot of people ask me, can this be put in remission, type 1 diabetes? So what we have experienced is that if you were recently diagnosed, it is possible. So we have a son of a doctor that came to our lifestyle center, and he was just diagnosed with type 1, maybe 3 weeks, type 1 diabetes. So he came. So, of course, we're giving him all this, right? All these are for diabetes and for any other things. And he didn't need any insulin at all the whole time. And he went home. He kept up with the diet. So it was summer. So it was summer, and then come September, October, November, no insulin. Guess what happened in November? Yeah, Thanksgiving. He went back to insulin. So, I think for these type of conditions, you have to be strict. And But that was just amazing for us that he was able to. No need, there was no need for insulin. Okay. Okay, here we have more cases, but I just want to go to her condition. So Hashimoto, what does it destroy the thyroid cells by the antibodies? That's the study that shows that. So her father died of complication of hyperthyroidism, and the mother died when she was 50 for pancreatic cancer, and she had lots of anxiety. And of course, when you have leaky gut, you're going to have leaky brain. It's going to affect your brain. So that's why people, come back to life when all the leaky gut and digestive issues are solved. And the two sons were dealing with Hashimoto. They were in their 30s. So it's 3 people in the family with Hashimoto. And so, we decreased the weight. Her weight was 128. She had a lot of edema, also weakness, fatigue, brain fog, depression, bumps on the back of upper arm, abdominal bloating, joint pain, poor ambition. The TPO was 300. That's pretty high. Her H1C was 14.7. Really, really poorly controlled her blood sugar. And so her diet she was following, I think she was following paleo. No, there is another diet that it is the autoimmune diet, right? Isn't it the autoimmune diet? It's an autoimmune diet. What they do is, it's kind of like paleo. And then, so she was eating salad and meat. That's all her food. And she was mostly in bed. So her weight went down. I think she was 150 or 140 or something. Went down to 120. Ankle swelling went to 0. Brain fog to 0. So no more brain fog, no more depression. All the bumps went away. The indentation on side of the tongue, she had indentations were okay after normal. Abdominal bloating went down to 0. Joint pain, 3 to 4 to 0. Long distance vision decreased, significantly improved the long distance. TPO went down. Remember, it was 300, went down to 180. By now, she probably has normal TPO. And the insulin requirements, they see, start coming down. We put the dates there. And the TSH 2.8, and before was 3.7. TPO went down to 180. The H1C start coming down. Ferritin improved. So what we did is the onion broth that decreased blood sugar, sunshine decreased blood sugar, turmeric decreased blood sugar, ginger also. That I have studies on the ginger, all the stuff that ginger does. So we do 3 teas in a week. So 3 nights a week we do ginger tea. Not as much because we've been counseled not to do ginger because it's very stimulatory also. So we just do it as a remedy. So she was doing mild exercise because remember she didn't have any energy. But when Dr. Joyce came to the program, went to the weekend after we did most of the detox, and she was walking with us. So she was walking with her, and she was telling her, before I couldn't walk. Oh, I thought you were just like that. So she was very surprised. So we're using the peel of the orange, apple sauces, orange sauces to increase the blood sugar when I was down too much. And this patient was so sick, and now she's as healthy as you see let's see, the picture there. See, she's just full of energy, went back to work with horses, and I think she has 80 acres. That's, so God just restored her health, and she's very, very faithful lady from, not a Seventh-day Adventist, but very, very spiritual lady. So that's all for the presentation. So we can do questions and answers at this time. Any questions? Okay. Okay, how do I make an onion broth? So we do 1 onion, 5 cloves of garlic, you mash it, and then you boil it for 20 minutes. 3 cups of water. We do times 3. For some people, I need 9 cups a day. We do, we drink as much as we can throughout the day. You can drink from 1 cup to 8 cups a day. 5 cloves of garlic and 3 cups of water. Boil for 20 minutes.
I have a question. How aloe vera repair bone?
How does aloe helps the bones?
You're right.
Well, we just eat it, 15 minutes before meals and at bedtime. Mm-hmm. No, we eat the gel. Mm-hmm. And chew it.
Do you have a protocol for high blood pressure?
Protocol for high blood pressure? Yeah. High blood pressure, we do, if it's very high, we do like 1 cup of water every 10 minutes for 1 hour to dilate the arteries. We send it to the sun. When it's super high, one time when this person came to a lifestyle center, leaving the medications at home, and she lived in Texas. She came to our lifestyle center, and then we were like, the blood pressure was super high. It was like at 200 something over 120, and we're like, oh boy, she's gonna have to go to the ER, but let's try something before we send her. So we put hot water till below the knees in a 5-gallon container and cold in the head. Somehow it keep decreasing the blood sugar, the blood pressure, and then we keep doing until the blood pressure was acceptable. And then we start checking her blood pressure every 4 hours and doing that treatment because we couldn't afford, right? Going high and then going to hospital. So that helped bad. You had to do a lot of water and a lot of sun and do all these natural remedies that work for blood pressure too, right? All those that we mentioned, the super healing foods.
I have a question regarding you mentioned onion. Does it make a difference if it's red onion or white onion?
Red onion, we like red onion better than white onion. And then, or yellow or red.
Yellow, okay. Mm-hmm. There's the sweet, and does it matter if it's the sweet or the regular one, I think they call it?
Oh, we try not to be the sweet because we don't want so much sweetener. We're in the low glycemic.
And on the same onion question, you mentioned that the raw onion versus the cooked onion have different effects. What does that look like?
It's kind of like garlic. Garlic is good. Certain foods work better raw, or certain foods work better cooked. So we want to be sure we tackling from both sides.
Okay.
Yeah.
And then another question regarding flax seeds. Is it best to grind that or to just eat the actual flax seed?
We grind it.
So you measure that ground, right?
Yeah, we measure ground it. Yeah.
Hello, over here. I have a question. You have an establishment where you treat people. Do you have a brochure that has the information about where this
What we
is?
do? I have a schedule with everything that we do. You can send me an email. I can give you a card, and then I can email you a schedule.
See you after?
Hmm?
Can I see you after about that, afterwards?
Can you put it on the screen?
Oh, the schedule?
No, your information.
Oh, the information.
Peggy, she's got a card she can give you after the meeting.
Okay.
Yeah.
Yeah.
And
Anyone else wants one?
I have another question. Do you have any success with liver cancer?
Like I said last night, it's up to God. right?
Yes.
We still had to do all we can, and we might be able to have success. We had a guy that had a gallbladder cancer, and he had a tube that we had to empty at night when he came. I didn't want to take them because they were elderly and, it's very high risk. But, they were like, really wanted to come. So I let them come, he and the wife. So I will bring the aloe every night to him, and I empty that. So he had an internal tube and external tube. And he went to the doctor after a week and removed, and he said, the cancer is gone, So, God can do miracles because you will need a miracle. So all we can do, all we can, and just leave the rest to God.
No, we have a family member.
But
with-
we have to do all
Yeah.
we can, and because all these things work for cancer too.
Yes.
So people that have come with cancer to our lifestyle centers, several of them have been put in remission. But we don't focus on cancer because it is another, you have to do a lot of research for cancer, and you have to do, but all these things work too for cancer. But our lifestyle, we basically do mainly.
So well-established, like stage 4
Yeah,
would
but
not
it
be as-
works, it
effective.
can work, yeah.
Okay, thank you.
I wanted to ask a question about the aloe vera. With the aloe vera, are you peeling the aloe vera? Some people have a reaction to the green part of the aloe vera, so you would shave it, cut it and
Yeah,
take
the
out the
skin
gel.
can be toxic also. The skin
Yeah.
of the aloe vera can be toxic, so we put in water.
Yeah,
Leach all this, latex and everything
Okay.
else, the bitterness, because if you drink that, it's so bitter, not good.
Yeah.
It's red. And then we change the water every day, and we only take the gel.
gel. Okay. Another thing, have you tried the Partiaco? Some people that I've talked to and that we have been helping. The Partiaco tea is one of those teas that's known for cancer. And
Yeah.
we've had people come back and say, my doctor says I'm in remission, or my doctor says they didn't see anything. So I didn't know if you ever tried the
Well,
Partiaco.
we don't focus on cancer, so
Okay. Yeah.
we just know that this has helped
Yeah.
several people with cancer.
Okay. One last thing. What about people that say when they eat onion and garlic, they say, oh, I can't do that because it gives me more irritation of the bowel.
Yeah. So we don't do raw on people that have cancer or gastritis of ulcers because it's going to hurt. Not
Yeah.
even lemon, it's
Yeah.
going to hurt. So we take care of that problem first, and then we try it in 2 weeks. Usually they can tolerate it in 2 weeks.
Right, right.
There's here.
Hi, I have a couple of questions. I'm wondering if you treat for MTHFR gene mutation.
Well, there's a mutation. So the problem with that is it can be problematic to, heart issues, and it's folic acid involved, and vitamin B12, metabolism, all that stuff. So it seems that when you sprout foods, it helps with the supply, whatever is
Okay.
the problem with the mutation.
I'm currently getting treated for it naturally.
Okay.
So I was just curious what your methods were.
Yeah, there's so many mutations that we have. We don't, if you do mutation tests, it's not going to be just the MTHFR. It's going to be so many other mutations. So we really don't focus on that. What we focus is repairing. And it's not going to repair only one issue, but it's going to repair all
So
the
out
other
of the main
mutations.
5 that you can have a gene mutation with, I have the one that, like I was telling you. And now I'm doing much better now that I'm being treated for it. But I think it's good just for people to know that 40% of the population have it. And if your body
It's very
can't
common.
methylate, it can't detox. So all those natural
Methylation.
remedies you were showing, I did everything under the sun and I was still so sick because it was just redistributing those toxins in my body. It was not helping because it's the worst gene mutation to have, but the easiest one to fix.
Okay,
And so I
thank
think
you.
that's good to know. And then my second question is, do you treat for jawbone cavitations?
For what?
Jawbone cavitations?
I'm not familiar with that.
Okay. Just curious. Thank you.
Okay.
I was just curious, you mentioned making milk. How is it that you do make your milk?
How do we do our milk?
How do you make it?
Oh, okay. You know, we like to use coconut milk, sunflower. We make sunflower seed milk and pumpkin seed milk because those are the fats that we use. Coconut milk is very easy. We use the flakes, coconut flakes, not the shredded coconut, because it doesn't make good milk. The coconut flakes, 1-to-1, 1 cup of coconut flakes with 1 cup of warm water. It makes a super tasty milk. Yeah, and the other milks are in our book.
Okay. I have another question. Currently, I'm diagnosed of Parkinson's disease.
What
and
disease?
Parkinson.
Oh, Parkinson. Okay, Parkinson's disease.
I have 2 medicine 3 times per day, and I get tired of that. I feel like my kidney is very weak. So, do you have any suggestion to help me get out of this drug?
I think the main thing is that your condition, neurological condition improves. So that with the lifestyle program, you can improve and maintain it. And that's the most important thing. Now, decrease medications, that's up to your doctor and up to yourself. But the main thing is that your condition improves, right? You want, instead of going downhill, you really want to improve and maintain it. So that's what the program has accomplished. Well, that's our program. All that we talked today should help.
Hi there. I was going to ask, what's the best way to get more minerals in your diet?
How to do
Get
what?
more minerals?
Minerals, juices, greens, lots of greens and juices should be very good for
And
minerals.
are there regular supplements a person should be taking? Like for vegetarians or
The
something?
supplements that we do is vitamin D if it's not summer, and B12 if you don't grow your own foods. But other than that, we try to do it with food. Yeah. Because minerals, vitamins can be synthetic also. A lot of the binders and the fillers are triggers, can be triggers. So you have to really figure it out what is in there that might, because that could be a trigger. Because the people that come to our lifestyle center with a lot of vitamins and minerals, tons of that. So we say, can you put aside for us for a time? So then, you know, we do all through foods and super healing foods, and they start feeling better.
Thank you very much for your presentation. A quick question. On one of your slides, you had a picture of a soy milk. What is your experience with soy? Men, women, the pros, cons, what have you learned?
Well, soy is one of the foods that we don't use in our program, and because of it has been genetically modified, and people have been affected to it, and when they test themselves, it's creating issues. It's overstimulating the immune system, so we removed it. So people that have not been affected, they can eat the organic, and it's okay. But people that have been affected, then we have to remove it.
What's your position on iodine, like with Hashimoto's and
So iodine, what I always say, if you're deficient, you test yourself and see if you need it or not. If you need it, you'll take it. Yeah.
So get tested.
Get tested first.
Common test, but that's good.
Yeah.
Can I get more clarification on the onion and the garlic? I do not respond well to eating raw or cooked onions, and I can only do raw garlic the day that it's cut. How would that, you were answering somebody else's question about that. What about the broth? Will that still be as irritating to my body?
You said that you cannot have the raw.
No raw, no cooked onion, and I can only do raw
Okay.
garlic the day it's cut.
Okay. So it's not unusual. Maybe 10% of people have that issue. So we had to do more aloe. And anything that's not working as good as it is, and as even as part of our protocol, we remove it. Anything that even part of our protocol, we remove it if it's causing issues. Yeah.
Hi, I have a question about cough. Do you have any suggestions for chronic cough for children and adults, especially this season?
So it's asthmatic cough or?
No, like there's been quite a few kids in our family where they've had this cough, and it coughs so intensely it's hard for them to breathe. And
It's a lot of mucus too?
Hardly any mucus.
It's
like
dry.
a dry cough.
So it's kind of some type of allergies
It's
probably.
been having for like months, maybe over 2 months, 3 months.
It's usually related to some food that they are having issues.
Okay.
So I will try, a clean diet, the way we talk. Sometimes it can be milk, cheese, but I will give them very clean diet and see if that will totally change. Because that's very radical, having 3 months of cough. Something had to change. So I will change the diet.
So with the aloe, if you can't do the fresh, I know that they sell the gel stuff. Is that acceptable?
You can find aloe in Walmart, health food stores, Asian stores. It's really easy to find it. Sometimes in parts in Canada, you cannot find, but in the United States, it's very easy to find it. And we definitely prefer not the plant versus something in a plastic, even in a glass. We prefer just the way God created. Yep.
And then you said you soak it, and then you just take 1 inch at a time, but peeling it, and then just eat that 1 inch. You said twice a day?
15 minutes before meals and at bedtime.
No, not the skin. You don't eat the skin, right? Just the gel.
No, the skin, not the skin. Yeah.
Sorry, for the 1/4 cup ground flax that you said, do you try to dose it maybe half in the AM and half in the PM for people that have hot flashes?
Whatever you can take it. We try not to do it at night because it's fat. I was gonna delay the digestion process, so I will do it at breakfast or lunch. I like to do it. I have my smoothie. I put 1 tablespoon of flaxseed, and I eat a little bit of flaxseed and a little bit of the smoothie, and it's a pleasant way. But if I mix it, the consistency is not going to be good.
Yeah, it'll gel up. That's what I was going to ask you, how you
so
do
that
it.
Eating that way is
So
is
some of
pretty
it's
easy.
like toasted, and some of it's incorporated in your smoothie.
Something.
It's like toasted almost, like the flax meal, right? It's not toasted, but it's
a meal.
more of
yeah.
a grainy.
It's
And
a
then-
very
Fine, yeah.
Yeah.
You mentioned there were 4 pseudo grains: quinoa, amaranth, buckwheat, and then there was a 4th
Kaniwa.
one.
Kaniwa.
Oh,
Kaniwa. Yeah.
Okay, thank you.
You can find it in Walmart.com, not in the store. Walmart.com or Amazon.
How do you cook that?
Same as quinoa. It takes longer to cook, so I cook it in an Instant Pot overnight after sprouting.
Oh, you sprout it 1st. So to sprout that, how do you
All
sprout
this,
it? How do you
all this
like
12 hours soaking, 12 hours sprouting. And this is the case for anything that we sprout.
How do you sprout? I know, but how do you sprout it? Do you just drain off the water?
You can go,
What
I
does
have
that
a
mean?
YouTube channel.
Oh, okay.
It's called Gut Health Kitchen, GUT, Gut Health Kitchen. And there is a little video, 3-minute video, how to sprout.
Perfect.
That's going to be, the visual is going to be much easier. Have a lot of recipes on breads and cheeses and desserts and things like that.
And I'm sorry, one last thing about the protocol that you mentioned, because I wanted to ask about nuts. I think you avoid most nuts. Did you say for 2 months, and then after 2 months, can you add
We're going to
slowly
introduce
back
one
into?
at a time, every 4
Okay.
days or every week, to see how you tolerate them.
But
And
for the
you-
first 2 months, you don't use any nuts, including coconut milk.
No, coconut, people tolerate it really well. It's just
Okay.
the other nuts.
Okay, thank you.
By the way, cashew are not nuts. Pistachios
The
are not nuts.
legume.
Yeah.
Yeah.
No, cashew are fruit. It's a fruit. Yeah. I think okay.
What do you do for asthma cough?
The diet has to change.
the
Something in the
diet.
diet is causing.
Okay.
Yeah.
And then combination of foods, like is there vegetables that you should not combine with other vegetables or certain fruits that you should not combine with fruits? Because I know that there is this theory like certain, you should not eat fruits and vegetables at the same time. Does that follow for vegetables and vegetables, certain vegetables you shouldn't mix together in a meal and certain fruits you shouldn't mix?
So
And
we
what
do
are those?
greens for lunch and fruits for breakfast. So
Any
we
kind of
separate
fruit?
them.
Any kind of fruit? Or there's fruits that you should not consume at
Any
night?
fruit, all the fruits are breakfast. The ones that are more lemons are okay for either. But other than that, fruits, we separate fruits with greens.
Okay, thank you.
Could you tell us a little bit about vinegar? And the second question?
Well, vinegar, we don't use vinegar. Anything that's fermented, we don't use it. And we, vinegar is too, you put vinegar in your face, it's going to burn. So you do it internal, it's going to do the same thing. And we have been giving counsel not to use vinegar, so we do not use vinegar.
And now, for health reasons, what kind of fasting would be best?
What kind of fast?
Fasting.
Fasting, we can do with water, we can do with juices, it's different type of fasting. Juices will be great, or you can fast with onion broth, couple of days, that will be great too.
So, I was going to ask you about the days of fasting.
Couple of days should be good. Otherwise you'll be suffering a lot. And I don't think suffering is a good thing. Might make you sick just from suffering. There's a couple of hands over there in the back. Okay, go ahead.
Do you eliminate nightshades?
Nightshades we eliminate totally.
Okay.
Because I can tell you, if somebody is following our program and they eat nightshade, then the whole, all the pain, the inflammation is going to return right away. Nightshades with somebody has arthritis. So we don't do nightshades for the 2 to 4 months until the symptoms are gone, and then you reintroduce one at a time.
Okay. Yeah. And millet is not considered a pseudo grain?
Millet is grain.
It's a grain. Okay. Thank you.
Even teff is very tiny. For a long time I didn't know is teff pseudo grain or grain, but teff is grain. So anything that grows in a grass is a grain. It's very, very different way of growing.
Have you tried sprouting, though, the barley green? Because barley green, and once you sprout it, you can dry it, and then you create a powder, barley powder, and then you can also add with that, you can add the, wheatgrass powder. And it's been said that people have internal issues like that, stomach issues, that I've heard testimony after testimony how they came through all of that.
Yeah, I did barley grass juices that's when I got sick. So I'm not sure about that. So we just don't do it.
Just one more question here. What is your protocol for incontinence?
Incontinency. The lady that was, one of the ladies had incontinency. Somehow it was gone. I think inflammation in the bladder also is going to improve, because the inflammation is going to improve all over your body. So she was fine after that. And people that, have you seen people that go to the bathroom continuously? So that's called neurogenic bladder, and that's an autoimmune disease. A lot of inflammation in the bladder. And so what we do for them, follow the protocol, and we see them in the hot water till the waist for 3 minutes, and then go in the cold, and then go back 3 minutes, So we do it like 5 times, and that's super help, relieve that neurogenic bladder. Really helpful. But you have to follow the diet to decrease inflammation that's causing the problem.
Do you, how many kinds of food do you eat in a meal? I mean, like 2, 3 kinds, or what?
Well, there is this, God has given us the carbohydrates, the fat, and the proteins, and, all that. So all those components have to be eaten in one day, and not varieties of those. So in a day, some, part we put it for breakfast, part we put it for lunch. But if you let's say you're just drinking a juice for breakfast, you're missing a lot of nutrition there. And or in lunch, sometimes people just eat 1 thing or 2 things or just salad. Then you're gonna be missing a lot of nutrients that's supposed to be eaten in a day. So our meals are complete meals, and they're pretty balanced with every requirement the body needs to have.
So did you say you have recipes?
Yeah, we have a book. Sorry, I didn't bring, I forgot. So we have books, you go wholenessmarket.com, and we have books, we have a companion. One book is cooking, and one book is with the protocols and the diet for the protocol. So those 2, you can find it there.
Thanks.
Wholenessmarket.com.
Thank you.
Mm-hmm.
I have a question about, you mentioned smoothies, but you don't mix the fruit or vegetable or greens in the smoothies together. You keep them separated.
No, we do not.
Okay.
Yeah.
Oh, so there was a question about when you're doing like a fruit smoothies, do you not usually do those, or you do more of like the vegetable smoothies more?
Well, the vegetable smoothie for me is a pesto. It doesn't even have water. It has cucumber, has celery, parsley, cilantro, green onions, basil, avocado, lemon salt. It's so tasty, but it's not even water.
Okay.
So I eat that. I try to eat that every day. And for breakfast, we have a smoothie that we put fruit, and we put coconut, shredded coconut for the fat. We put some sunflower seeds or pumpkin seeds. We put carrot because it's superfood for digestion, and some flaxseed. So that's our smoothie for the morning.
Okay.
Okay, I guess we done. Maybe we can pray, and I just wish you a lot of blessings as we start your journey, medical missionary journey. Yeah. My friend actually is available. She's done 2 programs, ARP programs for the community. People really love the program. She can help you start a program if you guys wish to start an autoimmune recovery program in your church. Also, if you want to train with medical missionaries, please go to medmissionary.com. We started a program tomorrow. You can sign up tonight if you want to start your journey as a medical missionary. Tomorrow is the 2nd of February, and we're going to start a program tomorrow. It's going to last 2 months. It's only Sundays, 2 hours. And if you miss it, we record it. You can watch later. So you can do that program. The program is on Zoom. It's live, and we do questions and answers. It's very, very active program. And then, but we do the class live. But then you have the science behind it and videos in that program. We have natural remedies, a lot of videos of all kinds, have to do politics for all kinds. You're also gonna, videos how to prepare those foods. We'll give you the whole menu of breakfast and lunch, 4-day menu that you repeat. And we give you the protocol with the timing, how to take the protocol with all these super healing foods. Everything, you can download it and just do it. So, we also have the history of the pioneer work of the medical missionary and the Bible and the health message. So we have all that. You will probably have to do like a 2 hours a week, 3 hours a week, just when you're cooking and you're driving, just listen that. And you're gonna have a test at the end, and then you're gonna get a certificate of completion of medical missionary. And also you ended up being a coach, because you get all the materials and you can start coaching people because you have the program to coach. It's very simple. We made it so practical because we realized talking, but then how do we put it together, all these talks? So we put it on menu and the protocol, timing, ready to go, so anybody can follow. You can coach people to do this. So that's what we do. You can do part-time, you can do Sundays, coaching other people that are sick. So many people are sick, so if they come to you, I'm very sick with this. I do coaching. Can I help you? You put a price to it if you wish. You're going to practice for free at the beginning and then charge, whatever you want to do. But that's what we do. We train to be coaches also. Okay, so God bless you. Let's close with our prayer. And dear Heavenly Father, thank you so much for your blessings. Thank you for giving us so much information to know how to navigate in these times and to help other people, to bring people to you. And we just want to live with many people for eternity. And we want to impact people with your power, with your messages, these amazing messages that you have given us. This is to bring hope to people in every sense of the world. So please bless us. In Jesus' name, amen. Mm-hmm.